Great. So now we're going to help our young Angela with another emotion. So there's a way to test, according to Dr. Viktor Frankl, who developed total body modification, who died about 3 or 4 months ago in 2010. Go ahead and you're going to keep your knee straight. You're going to push straight up that way. Push, push. Breathing in and out. Okay, so that muscle is not locking properly. And that muscle relates to hypoglycemia, or low blood sugar. Why do I need a lab? You can do in vivo testing. I have my patient right here that I can test. And go ahead and push up here, breathing. Okay, and that muscle's not locking properly. That one relates to hyperglycemia. And thumbs pointing backwards, elbows straight. Push back towards the table, towards your buttocks. Back straight towards the ground and your buttocks. Push, push, fully, breathing in and out. Okay, and those aren't quite locking properly. Okay, so go ahead and think about when you're 8 years old, that thought, the moving stuff. Okay. And we're going to do an adjustment here. I'm doing my best here. You're good. You're fine. Just try your best. Okay, so you're thinking of that, Angela? Okay. Ooh, that was a big one. Okay, good. Go ahead and push up towards the ceiling. Push, push. Knee straight. Breathing. Hey, wasn't that weak a minute ago? Mm-hmm. Wasn't it weak a minute ago? Push up towards the ceiling. Push, push. Okay, so that bone is called C5. It relates to blood sugar. Probably good to know in today's society, right? People having trouble with their blood sugar. Okay. Look at that money. Push up here real hard, breathing. Wait a second. I could have sworn that money was causing her to get weak just a minute ago. Push up there, breathing. Now she's doing pretty good with the money. Yes! High five! Okay, so we can continue. What I do is, when I'm pulling down on people's arms, would you guys like to know what I'm doing when I pull down on a patient's arm like this?
Oh yeah. Okay,
if you'd like to know, I'm going through a menu, a list of things. And this was developed by Dr. Viktor Frankl and Dr. Scott Walker, who developed neuroemotional techniques. So I ask questions like, should I do a structural, chemical, or emotional therapy? Structural, chemical, or emotional therapy. Her body's telling me when it gets weak, that's the one that I need to pursue. So it's not a structural problem, it's not a chemical problem, it's not electromagnetic, it's not necessarily a toxin. The priority, the thing that she needs help with the very most right now, as we speak, is emotional. Okay? So then I can go ahead and address that. So put a hand on your forehead, please. Thanks. You doing okay? Mm-hmm. Okay, eyes open. Okay. So this has something to do with love, or money, or you. And it could have something to do with your role as, and then we go through all these different roles in her life. Okay, so you're thinking about that, Angela? Mm-hmm. And take a breath in. And out. That's pretty good. Okay, and then lie on your back, and then I want you to think, please lie on your back. Think about each time since that time that you've had. So think about the next person then. Are you thinking of that? Okay, so just think about that. Try to relax. keep thinking of that. Try to relax here. Okay, good. And then think about the next person. Are you thinking of that? Good job. And then think about the next person. Are you thinking of that? And the next person. Are you thinking of him? Or her? Okay, good. Okay. So then we go on and we check by doing this arm pull-down test that we came from Dr. Victor Frank and Scott Walker. Is it something structural, chemical, emotional, or a toxin or electromagnetic? So then it could be cervical, thoracic, lumbar, sacrum. So it could be extremities, extremity fixation, facet, spine. So our extremities are our arms, legs. Okay. So upper body, lower body. Okay. So it could be the bilaterally. Okay. So it could be, you know, this joint here, that one there, the shoulder joint, or it could be the elbows or the wrists. Okay. So we'll adjust your wrists. There's more people to think about, so think about more of them. Okay? Good. So just keep thinking of this one person, whoever they are that you're thinking of now. Good. Okay, great. So you go ahead and put these two fingers together like that, with them straight. There you go. Those don't lock in place too well, so let's help you with that. And then let's think of the next person. Lots of clickies here. I know you can't hear it with that little microphone, but that's good. Now the wrists relate to the stomach. And we're helping her, and emotions. And we're helping our friend Angela with her stomach and with emotions. She really needs help. She really needs help with this one. I know it doesn't feel good. Just you doing all right? Mm-hmm. It's kind of a lot to deal with. Good thing we're doing this, Angela. Okay. Okay. So there's still some bones that are needing to be realigned. You can just feel them. This isn't, and everybody's different, so you gotta, you know, when I'm treating people, I'm thinking, how do I help this particular person, right? Okay, let's try that. Go ahead and put those fingers together. Okay. Try to keep them straight as best as possible. Okay, try it again. You ready? Okay, that's a lot better.